Good afternoon, and I'd like to call the special meeting of the Board of County Commissioners to address emergency management related to COVID-19 and the local state of emergency. This is a new group, and I want to welcome you all to this meeting. Today, we're going to take things a little slow because we want to get you all indoctrinated and get your feet wet to what we've been handling since March, really. I think it's been March, the last 5 months. So again, welcome, and if you have any questions, please ask them. Let's not get overindulged in questions, though, but we're here to answer any questions you may have. Will the clerk please call the roll?
Good afternoon. Miller?
Here.
Hagan?
Here.
Kemp?
Here.
Merman?
Here.
Overman?
Here.
Smith?
Here.
White?
Here.
Thank you. You have a quorum?
Okay, is Commissioner White here? Commissioner White here?
Yes, I'm here. Can you hear me?
I see now. Okay. Yeah, we can hear you now, Mr. White. Okay. We still don't have any public comment, Mr. Brewer?
That is correct, sir. Zero comment.
Okay. We're now moving to emergency management update. Mr. Tim Dudley.
Good afternoon, board members. All right, can you see the slides here?
Yes, sir.
All right. Good afternoon. I'm Tim Dudley, Hillsborough County Office of Emergency Management Director. I'd like to give you just a brief overview, as we do have new members, of some of the current operations that we've had going on since March. As you know, we've been doing community testing. We have 8 community sites, and we continue to support those sites at Raymond James, Lee Davis, South Shore, Plant City, Brandon, Sun City, Waimama, Town and Country. And we also have 2 ambulance providers that provide in-home testing for those who have challenges making it out to our collection centers. Just to give you the current update that we have here. We have testing conducted last week. We did 8,342 tests. Total tested since the beginning of the operation as of the 4th, 85,840. Tests conducted this week at the close of business on Tuesday, we had 1,686. Last week, we had 8,755 appointments scheduled. As of Wednesday, we have 4,110 appointments scheduled. And we currently, just to give you an update of some of the challenges that we've been having or trends we've been seeing at the collection sites, we currently have been experiencing a 50 to 60% no-show rate. As we're starting to track, we see the demand starting to trend downward. We're going to continue to monitor that, but we have plenty of appointments available for the community who still would like to be tested. So call center, they have short to no wait times at all. And we're currently, under our currently testing procedures here, we have 2 labs that support our testing. Our new lab, we've been using Quest since March, and just here recently, the state sponsored a new lab here for Hillsborough County, eTrue North. We just brought them on board last week. They started at Raymond James, and we just recently converted our community centers at Lee Davis, South Shore, and Plant City. They've just come on board, so we're hoping to see some positive trends. We look like we're getting a good 3 to 6 day turnaround. So having 2 labs here in the community, we hope to see some relief and keep those turnaround times down. Also today, taking place, Raymond James is state sponsored. That means they're providing all of the medical staff and all of the PPE and testing supplies in the laboratory. We do have county personnel out there and the city of Tampa personnel out there providing site support through security and also some administrative and logistics efforts out at those sites. The state did sponsor Lee Davis, South Shore, and Plant City with some medical personnel. We're transitioning from that medical personnel today to where the county will be putting a medical staff, contract medical staff in place as the state just provided that support temporarily, but they will continue to sponsor us with new testing kits. We also started new testing kits at Raymond James, Lee Davis, South Shore, and Plant City. Those particular sites are self-administered tests. So those tests will stay in place. And at our other outstanding sites, Town and Country, Sun City, and Waimama, we will continue to use the Quest kits. We've had tremendous community support up until recently here last month. South Shore, Plant City, and Brandon was supported by the USF medical staff, and we certainly appreciate the support that they provided as they transitioned over to the state teams. Our Town and Country site, we've partnered with Tampa Family Health Center. Our Sun City site, we've partnered with Redeemer Lutheran Church, and that testing is supported by two of our ambulance providers that also conduct our mobile testing. And our Waimama site is supported by Enterprising Latinas, another great community partner that has been helping us with our community testing. This particular testing has been ongoing. We're trying to meet those marks, as Dr. Holt will get into that. We're hoping to see in the near future as more of the demand becomes to a reasonable level, that our healthcare providers and some of our big box stores like CVS, Targets, things of those natures that are also providing additional testing, that they're able to absorb the community testing as we move towards looking to transition away from these larger sites. So hopefully we can keep moving down in a positive trend and strategically transition each of these sites from the community as as we hope to see them stand back up, like our healthcare centers that are supporting us now. Any questions about testing before I move on?
Hold on, Commissioner Overman, you recognize.
Thank you, Chair. Thank you, Mr. Dudley, for your report. That's very helpful. I understood you to say that you're using Quest for testing at the remote sites. Is that what I think I heard?
Correct. Quest is still in place at our Brandon, Town and Country, Sun City, and Waimama sites.
Okay, so this may be a question for Holt when he's available, but I've gotten complaints from citizens that are concerned about the turnaround time on test results at Quest being significant and much longer than LabCorp. Is that still the case to your knowledge, or do I need to check with Dr. Holt on that?
We could, if you could provide that information to us. We work closely with the labs and we try to resolve those issues if you can provide that. And we're in constant communications with them. And there's still a demand across the nation for these labs. That's why we brought the second lab in, the state supporting on that. So hopefully we can start seeing some relief for Quest turnaround times.
Okay, thank you very much.
Commissioner Kemp, you recognize.
Oops. Thank you. I also wanted to ask about the turnaround times, because I think that's obviously extremely significant for us. The other thing is about this chart, daily tests collected. Does that include, this is the tests that the county collects, not the private tests that are done, correct?
That's correct. These are the county supported sites. Dr. Holt has the overall community numbers.
After the fact.
And My only question was about the line going straight up, as if always more tests and more tests are being collected. But then it looks like there's a little bit of a downtrend there overall. Is that not accurate, or?
We are start seeing a decrease in demand. The call center, we also have online registration for both labs. But the call center has started to see a decrease in the calls that they are receiving. We're starting to see it in our daily reports from the collection sites. So June, we had a spike when we had that uptick, as you can see here on the chart, around the June timeframe. Numbers and the demand was significant. And that's why the state was able to come in and provide us that assistance. And they're still here on the ground providing that assistance, but we are seeing that trend. And also we did see the potential for the storm coming in last week. So they're out of abundance of precaution. The state did have us take a look at possibly canceling testing, but the track of the storm, they were able to make that call where we didn't have to shut it down. But we are continuing to monitor and get the word out that appointments we didn't close, we're open for business, and tests are available.
Thank you. That's it.
Okay. All right, Mr. Dudley, you can continue.
We also have significant logistics operations and have an outstanding logistics team here. As you can see, we've put millions and millions of PPE, and these are the most significant items, the most critical items that support our ALFs, nursing home, hospital staff, as well as our testing sites. So the state has been providing tremendous support when it comes to those resources to continue to help us keep our sites open consistently. Since day one in March, we haven't had to close any of our sites due to any resource constraints, and then just having a great partnership. As you can see here, we track, we have about 17,612 testing kits on hand. And we have over 2,700 mission requests into the state that we continue to monitor. So it's a constant balancing act with our testing program. We have that increase in demand that causes us to use more PPE, causes us to use more kits, puts a demand on our labs. So they're all intertwined, interrelated, and through great communications and our partnerships here, we've been able to come up with a consistent program. There have been some challenges with turnaround nationally, but what we've been able to do here in Hillsborough with our testing program, we've been able to consistently expand it and make sure that resource is provided. And I appreciate the leadership for giving us that opportunity. As you'll see here at the bottom of my left-hand slide, you see quarantine site and isolation. So this is another ongoing part of our operation that a resource has been provided here to the community, working with our healthcare partners. We have some of our citizens that may not be able to go back home and quarantine and isolate. So we've had 2 hotels in place where we can provide that service, as you see right now. As of the 5th, we had 1 guest in quarantine and 1 in isolation. Just recently, we've combined the quarantine site and the isolation site into 1 hotel. And the reason we've had to do that, we've had that uptick in cases that the hospitals are starting to see some challenges for capacity. So again, we were able to put a resource in place, and we've had some tremendous teams on our task force to be able to do that. And one of the hotels is the West Wing Hotel. It's a boutique hotel, and it's currently been outfitted, operated as one of our alternate care sites for low acuity COVID patients from local hospital systems. And we've kicked this partnership off with Beck. We've worked closely with them to convert the hotel. Residents who are hospitalized and near discharge can be transferred to the West Wing to receive care in a transitional setting while they recover from COVID prior to being ready to go home. The site will be staffed 24/7 with nursing staff who can provide patients with routine care and monitoring during their stay. We're starting off with 50 beds, but we have the capacity to go up to 100 beds. And this is not just a partnership with Beck. This resource will be available to all of our healthcare partners as we get over this uptick. And again, this was a resource that we were able to put together in a partnership and provide this greatly needed resource. And Dr. Holt can elaborate a little bit more on that if he wishes to doing that. So also we have another vulnerable population in our ALFs, adult living facilities and nursing homes. And we've provided an additional resource in University Village. This has a capacity of 120 beds. We have about 60 guests there. And this is a step-down facility. For those citizens we have to bring out of those ALF nursing homes, they have to go to a hospital, but they still need some recovery time. So we bring them back to University Village to finish their recovery period before we transition them back to the ALFs and nursing home. Dr. Holt and his team, Gene Early, as well as our healthcare providers, we've taken an aggressive approach with our testing supported by the state as well as DOH to ensure that our most vulnerable are taken care of and we're able to adapt and adjust to those situations. So as you can see here, we have quite a bit of significant operations here, multiple facilities going on, multiple testing going on here. So emergency operations has been up and running since March at a level 2 activation, as well as being prepared for hurricane season and any other hazard that may approach us here. And now I'll answer any questions.
Okay, thank you, Mr. Dudley. And I see no questions, sir. That concludes your report.
Thank you, sir.
Thank you, appreciate it. We're now moving to public health update, epidemiology review, Dr. Douglas Holt.
Hello, Commissioners. This is Dr. Holt from the Florida Department of Health, Hillsborough County. I'll begin with a couple of answers regarding the testing. First, the turnaround time. Talking to my epidemiologist, and they try to compare when they see the tests were collected and when they're coming back. And in the last week, they did notice that they think there's a little improvement from Quest and LabCorp. Previously, they were +7 on an average, but some real outliers. Now they're maybe 5 to 7 days. As Mr. Dudley talked about, the county has done a remarkable job to make the test available. But as the labs have been increasingly, demand has surged, they have not been able to keep up with the volume. The second report or second mention was that Mr. Dudley, they report the number of tests that are collected. What we report will be the number of tests that have been reported back. We only report back those that have had what they call the PCR test. That's generally the nasal swab, or this newer test that's just coming out and it's starting to be seen. It's called an antigen test. We do not include antibody tests in that report, those numbers. If I may, I'd like to make a few comments. What we know about COVID is much different than what we initially thought. If many of y'all remember, I came and spoke to you early March after our first case. And really over the past 5 months, some of the things that I initially assumed or had predicted have not been entirely correct. Science really takes time, and they say good science even longer. So there continues to be difference of opinions as expected. But a couple of points I would make, in my opinion, is that some of the most significant things we know is that asymptomatic people do play a significant role in transmission, and there can be airborne spread in certain situations. Still, despite that, direct contact with someone's respiratory secretions is a major risk, and hands to face are less so, but can occur. People who are infected, whether they're sick or not, do exhale the virus. Essentially, they put virus into the air in their proximity, so masks will reduce the amount of virus that is in the air that is expelled, and that's especially important when you're in a room with several people. Social determinants of health, we talk about those. They're on full display with COVID. Communities with low economic status, minority, people of color, increased risk for both becoming infected and severe disease. Becoming infected is because they often live in more crowded or smaller facilities, and they also work in jobs where they come in contact with a lot of people. And sadly, they are at risk for more severe disease because generally they have more comorbidities and they're not as healthy. Finally, children seem to be have less severe disease, but as I approach the school opening, I assume that they are just as likely to be infected or exposed, when exposed, and potentially infect others. So just a summary of what I feel that I now know, or my opinions on these. Mr. Wagner, would you put up the first slide? I'm going to do a very abbreviated review, and then Mr. Wagner is going to walk us through the dashboard. We have reported 373 additional cases today. Notably, that for the day, 6.8% of those were positive. We had over 5,000 tests reported in the last 24 hours. This total number is not as important as what we'll look at is the more number of the recent cases in the last 14 and 7 days. The first one we look at is the rolling 14-day average. It is currently 483. These are all the new cases that have occurred in the last 14 days compared to the prior 14. It's a significant decrease. We call this our incident rate or our attack rate. It represents those that have been infected recently and have the potential to spread the disease. The testing has been very strong, but I do see a flattening, and we've seen that statewide. So this is a bit of a concern. Hopefully it doesn't come, as Mr. Dudley mentioned, to us, because we really do need to continue to see our testing be as robust as it is. And then finally, the daily positivity, 14-day positivity rate, this fundamentally tells us, are we doing enough testing? Because if we can get these numbers down low, then we know our tests are including not just those who are sick, but we're including those that are left either mild illness or asymptomatic. So we know we are collecting as many as possible, and therefore our rolling 14-day average of cases is more accurate, and also we can identify those people who need to be isolated, interviewed, so we can reach their contacts. Next slide. Overall, this whole slide, except for the bottom, is good news. Our hospitals have decompressed quite a bit. The number of patients in the hospital has decreased, averaging now 7 days, 483. That's a 1% decrease. I have talked a little bit about the data on the occupancy of both the beds and the ICUs. There's a lot of variability here depending on your source of your data, and also the way the hospitals record how many beds they have, which is actually staffing beds, often besides the licensed total number they could have if they had the staff. The most important thing about this is the trend. So the average number of total beds is stable. There's a slight decrease, and a minor increase in the ICUs. So that's kind of their normal operational. And then finally, the COVID admissions is also, like the census, has decreased almost 20%, over 20%. And finally, the most lagging of indicators, this is deaths, and this represents infections that were probably a month ago, are now 382. That's a 30 increase, or increase of 30 from a Monday report. This number is somewhat problematic in that when they're actually reported, and I talk to the medical examiner regularly, oftentimes there's a delay in when the person died and when they're reported, as she collects information and has to do her job. So we are batching them on the dates of report, but the bottom line is it has increased significantly over a period of time. Fortunately, the last 7 days, it has decreased, and we're going to hopefully see that trend continue. I'm going to stop there, and Mr. Wagner is going to navigate through our through your dashboard.
Mr. Wagner, you recognize.
Thank you, Commissioner. Thank you, Chairman. Commissioners, my name is Kevin Wagner, Business Analyst for the Healthcare Services Department of Hillsborough County. What's in front of you, I will make it larger, is the Stay Safe page that's on the Hillsborough County website. This represents our public-facing dashboard. This was developed under the leadership of Ms. Wise in collaboration with Dr. Holt between the Healthcare Services Department and our Information Technology Department and our Communications Department. The public-facing dashboard is designed on the first landing page. Green is a positive or trend or flattening in the direction that we want. The red or salmon color is more of an areas of concern or areas that are not meeting our expectations. On the public-facing landing page, again, to date, this is updated every 12 hours as best as the data is updated by the sources. We have 31,563, which again, it indicates the 375 more that Dr. Holt indicated. Our fatalities as reported is 383, and the total recovered estimated is nearly 15,000 people as a whole from an aggregate. Our 7 and 14-day case changes are downward trending in a positive in green. As discussed with our testing data, we are seeing a flattening. The week beginning July 26, roughly 29,000 tests. As you can see, week over week, that's a slight flattening. So that is why that one's in the red or salmon color. The overall positivity on a weekly looking at the information on 14-day counts has trended downward through the week beginning of July 26th. The hospitalization data, as discussed by Dr. Holt, our main source predominantly is the TGH data exchange. This is encompassing data exchange at 12 to 13 hospitals. While it doesn't capture all the hospitals in the system for Hillsborough County, it allows us to look at trends and utilization. We are seeing a downward trend. We are seeing a downward trend in occupancy. Now, obviously, with the hospitals as they report, there may be a day or so delay, but the trend over these time frames is what's key for us in our viewing of the dashboard. And same thing with occupancy and items of that nature. This landing page is our case summary. This is a somewhat interactive page for the users. If I needed to look at the number of cases between a certain date range, this page does allow that. So in the date range selected from July 15th to August 5th, basically yesterday's data, there were 10,000 cases at various age groups, at various male and female gender percentages. Included in this, on this page, the number of hospitalizations by age group and the number of deaths by age group for this time range that I just selected as reported by the FDOH, barring we understand that there is a delay in the reporting of deaths. So this page itself allows for some interactiveness from a case data standpoint. With regard to the bottom graph, these are the number of cases as reported each day. So we are seeing the continual, we saw the uptake, and now we are seeing the downward and sloping trend of the 7 and 14-day cases. The 7-day case is 411. The 14-day rolling case is around 441. So again, this is somewhat interactive as we see the changing of information. The indicated orange or salmon colors are days of reference. This first one is June 5th, which is the state reopening phase 2. And the second one listed here is the Hillsborough County face mask order on June 22nd. We pulled these as significant benchmarks to see how the positivity of new cases occurring after significant date ranges or date occurrences. Our third page on the landing page is a high-level testing summary. While this one's not interactive, it is updated weekly. We can kind of gauge to see our testing, the number of population that has the COVID case within Hillsborough County. Right now, 2% of the population's been estimated to the confirmed case of having COVID in Hillsborough County. And we look at total testing with, as Dr. Holt and indicated, the PCR and the antigen, roughly 19% of the population's been tested. With regard to testing, on this bottom chart, this shows the number of tests that occurred in that week. I highlighted the last day or the last week. 29,000 tests occurred, 3,000 of which were positive, which yielded a somewhat 10% positivity rate. These lines are a 7 and 14-day rolling average of those. The last slide or the last page of the dashboard is focused solely on hospitalization from the TGH data exchange and some of the information from the FDOH. What is important to me on this page is the last two bottom charts. We are looking at the trend analysis, as I discussed earlier, as we are seeing a peak somewhere in July 15th, 16th, 17th. We are hoping for a downward trend or flattening. The 7-day average of the ICP and inpatient is around 478 as reported by the TGH data exchange. Again, it doesn't encompass all the hospitals, but it's a significant subset. So that trending is flattening or going down as we would want to see. And the daily admissions on this far right-hand side, again, the same concept, looking at trend analysis, around 40 on this last day of, I believe, of August 3rd or 4th. So that dashboard is available publicly and for all individuals, and as well as we try to make it interactive and informational for everyone. And I'll stop there.
Okay, thank you, Mr. Wagner. Look, members, I know you've been given a lot of information today, and sometimes it may seem as overwhelming. So if you got questions, please ask the questions so you can get your feet wet and understand where we are and what we see on a weekly basis from Dr. Holt and from Mr. Wagner. That's vitally important information that they bring forth. Okay, Ms. Wise, you recognize.
Thank you, Mr. Chairman, and I would like to thank Kevin for going through that analysis. It's really very comprehensive. Kevin, if you could put it up again, if you could, because there's also a quick snapshot that's available on page 1 that is available. So we have this very thorough piece of information, but there was a hyperlink on that first page that you can click, and it provides this very, he's demonstrating that one section, and you click on that hyperlink, and then there's a quick snapshot there for your stats at a glance for the public and for the members to see as well. And I just wanted you all to be aware that that's up on the dashboard at all times. Thank you.
Okay, and thank you, and Dr. Holt and Mr. Wagner, thank you for all that you bring to us to keep us informed of what's going on. And again, members, I know that some of you may be kind of overwhelmed. If you are, please ask questions. Okay, Commissioner Smith, you recognize.
Thank you. And I'm not really feeling too overwhelmed because I've been keeping pace with this as
Well,
it's been going.
I didn't mean it like that. I mean, this is the first time to this meeting, so I didn't mean that you didn't understand. I'll keep my mouth closed. Go ahead.
Trying to keep track and keep up to date. But I first of all want to say I'm just very proud of our county's communication staff and emergency staff for putting this information. For us to have our own dashboard like this is a huge community asset, and it really helps us all follow along in a real-time way and answer questions. And so I want to appreciate, I want to just express my gratitude for that. I have one question. It was said that we have 2% of Hillsborough County's population are confirmed cases at this point. So I'm wondering if we can get, if we have any other way of estimating without, I mean, I understand that these are the confirmed cases of people who have been tested and gotten positive results back and are still in our community. So how can we estimate I know there's like some percentage of people with COVID who have no symptoms. Certainly they don't even know they have it. They haven't maybe gone to be tested. And other people who get sick, but not emergency room sick. And so don't present it, since COVID has no cure. They may just, tough it out at home for a while without ever being tested. So the number would be higher than 2% of people who actually have COVID and are infectious in our community. But do we have any way of estimating how much higher? Maybe Dr.
Who wants to answer that?
Yes, ma'am. This is Dr. Holt. Again, a great question, and you're spot on. They've talked about using a test that's not reported as a case, and that's the antibody test. And right now they're getting most of the testing from people who either are interested in being tested or who are blood donors, in fact. It's not a true, complete sampling of the population. So even that right now is not very precise, but it definitely shows that there is more people who, which we knew, that have been infected than have been tested positive. At various times, I've seen Surgeon Generals and others estimate multitudes all the way up to 10%. I don't believe we're in that same category. Our testing has been quite robust, and so I think we are picking up those that have, or many of those that have low symptoms. But I can't give you an exact number at this time. I think over the next few months, if antibody testing becomes more pervasive and more sampling, the epidemiologists will be able, the scientists really will be able to give us an estimate. If you had to ask, if I had to give you a number, I'd say it's 3 to 5 times the number. And that's just an uneducated gut guess. I'll stop there.
Just to follow up, you would guess 3 to 5 times 2% or 3 to 5%?
No, 3 to 5. If you look at some of the other types of communities that have had more comprehensive testing, it's not uncommon to see them into the 8 to 10%. New York was much higher. Miami is going to be a lot higher. But again, that is just my speculation, not a fact. I'll stop there.
Thank you. Thank you very much.
Mr. Kemp, you recognize.
Thank you. I also wanted to comment on the dashboard being pretty incredible resource. Thank you so much. It's very good to see the hospitalization is down. And I know I heard Dr. Jason Wilson a few weeks ago talking about some of the, I know he said some very, very, very sick people are at home now because they've been able to give them oxygen at home and provide them with other kinds of things that weren't originally available. So that is good to see. Despite its imperfections, I mean, I think I really look closely at the daily or the positivity rate, still at almost 11%. As imperfect as it is, that is a number that looks like we maybe are starting to plateau at. And I think it's really important for people to realize that that is an extraordinarily high plateau, even though it's a plateau, a very, very high, outdone maybe only by New York at its peak, Miami, and Brazil now. So I think there's a lot of concern about how huge the community spread is. And I know that the letter we received from the Florida Society of Pediatrics was talking about a reasonable positivity rate as being closer to 5% and desirable down to 3%. I heard that repeated earlier at the school board meeting today. So anyway, great job on the dashboard. Great job on this information. Things look maybe like they're plateauing off a bit, but still very concerning. The only other thing on the dashboard that I thought might be a good indicator to look at is when I know the governor has changed orders with regards to bars. And I think that might be a good one to mark on there in terms of, I know you have two markers on there, the opening up and the mask wearing, but that might be a good third marker.
I think that was phase 2.
Thank you.
Okay, thank you. Commissioner Merman, you recognize.
Thank you, Mr. Chair. This is quick for Bonnie and Communications. The snapshot, is there any way to include that in the coin that you put out every day as an entry where somebody can just link on to the snapshot so that they don't have to go laboriously through the website to, stay safe and then onto the dashboard. So I just offer that as a suggestion because I think that's what people want. They just want to see the snapshot without having to search for it.
Sure, we can look into some easier access for that particular information. We'll work through that.
Great,
yes,
thanks.
ma'am.
Commissioner Smith, you have another question? Okay, so I see no more hands. So Dr. Holt and Mr. Wagner, thank you very much for your presentation. We appreciate it. Thank you very much. Before I get into the county attorney's update, members, when the EPG was meeting, we had a unwritten agreement or unwritten rule that if there was an amendment to a order that you wanted to have done, that you would bring it to one meeting, ask the county attorney staff to work on it, and then bring it back to another meeting so we could see it and then take action on it at that time. We would not take action on the particular amendment that you bring forth. So if you brought something today, you would ask the county attorney to bring it back at our next meeting. The county attorney would work on it. You would have a chance to review it before that meeting, and then we vote on it at that meeting. So I'm hoping that we can keep that rule, agreed upon rule, in place so we can continue to have a smooth transition if we're looking at having amendments to our executive orders. Is there any objection to that? Any objection to that? Okay. Now, having said that, I know today there are two motions that we must take up.
Mr. Smith,
Yes, Commissioner Smith.
Yes, there's not exactly an objection, but I would just maybe qualify it with the fact that we are meeting as an emergency policy body. So it's conceivable we could meet because of a hurricane and need to order an evacuation in a shorter time frame than a weekly proposal and then approval of something. So I would want this general policy to stay flexible for emergency considerations. And it might happen that even the COVID emergency might sometimes warrant fast action. So I just throw that out as so everybody understands this isn't a firm policy for an
If you
emergency.
remember what I said, if you remember what I said yesterday, that we were going to meet once a week, but we can call special meetings, emergency meetings. I said that yesterday. So if it does get to that point, Commissioner Smith, if it's a hurricane or the COVID numbers start to go up and we feel we got to do something, we could always have an emergency meeting. Okay? Is that okay, Mr. Chris Smith?
Yes, I mainly wanted the public to understand what the what the nature of the rules are that we're establishing.
Right.
Sure.
All right. Okay. Ms. Beck.
Yes, good afternoon, Commissioners. Christine Beck, County Attorney. I have two items under the County Attorney update. The first is the local state of emergency order, which by law, as set out in Chapter 252 Florida statutes, may only be in effect for 7 days. For the commissioners who did not serve on the EPG, this order is important to have in place in order to receive state and FEMA reimbursements at the end of the emergency. The local state of emergency order was last approved on July 30th, and therefore, Mr. Chair, it would be appropriate to entertain a motion relative to that order at this time.
Okay, I'm going to let a motion by Commissioner Merman. Is there a second?
Second, Commissioner Smith.
Second by Commissioner Smith to extend the emergency order for 7 days. Is there any discussion? Seeing none, please call the roll.
Miller,
Yes.
Hagan,
Yes.
Kemp,
Yes.
Merman,
Yes.
Overman,
Yes.
Smith,
Yes.
White.
Yes.
Motion carried 7-0.
Ms. Beck, you want me to take up the next one?
If you'd like, I could introduce it briefly.
Okay, go ahead.
Commissioners, the face covering order was originally approved on June 22nd of 2020, and then it was amended on July 6th of 2020, and a copy of that order is part of your backup for your reference. Since July 6th, the face covering order has been extended every 7 days, and the last extension was on Monday, August 3rd. By law, the face covering order is not legally required to be voted on every 7 days. However, the EPG included that requirement to review the order every 7 days in the body of the order. Therefore, Mr. Chair, since the BOCC will not be meeting on Monday, as I understand it, it would be appropriate to entertain a motion relative to the face covering order today. And that's all.
Well,
that's the end of my.
I have a motion prepared that since we will not be meeting on Monday and the order requires a review every 7 days, I move that we extend the July 6th order of the EPGs as extended, requiring the wearing of protective face coverings until next Thursday, August the 13th. That's my motion. I pass the gavel to Commissioner Overman.
Second.
Okay, we have a motion by Commissioner Miller and a second by Commissioner Kemp. Any discussion? Anybody have
Commissioner
a hand
Overman,
raised?
this is Commissioner.
You have Commissioner Smith.
Commissioner Overman, this is Commissioner White. I'm dialed in via telephone, so I'd like to ask you to call on me for discussion when it's my turn.
Okay, and I did see that Smith had her hand raised, so I will call on Commissioner Smith and then Commissioner White, you'll be next.
Thank you. And I will support this, through next Thursday. But I'd like to ask a question of the county attorney. We don't have to put any time frame on this, do we? Can we make this order until we repeal it?
Just hold on, Commissioner Smith. I got something coming later on.
Okay, but that's possible, right? I mean, it's not.
Yeah, just hold on. I got something to deal with you.
Okay.
that you might like. Okay.
All right. Commissioner White, you're recognized.
Thank you. I just want to say that I'm going to be voting against the face mask mandate, and I just want to put some reasons why on the record. I think it's too heavy-handed to mandate this from the government level and to make the penalties so strict. I think it's inefficient as public policy and extremely difficult, if not impossible, to enforce. And the ironic thing about these mask mandates is that they've become so politically charged and so controversial. I'm a firm believer that they could actually be counterproductive. I strongly believe that there are folks out there that would ordinarily be inclined to wear a mask based upon recommendations from public health officials, but that are absolutely not going to wear a mask in protest to these strict government mandates. So it's too heavy-handed in my mind, inefficient, possibly counterproductive. And I also want to say for the record that I believe strongly that social distancing and proper sanitation is the best, most effective way to slow and mitigate the spread of this virus. So just wanted to get those things on the record so that I'm just not a no vote without any reasoning behind it.
Excellent. Thank you, Commissioner White. Does anyone else have their hand raised? Just wave.
No other hands.
Okay, seeing no other comments, please take the roll. Vote.
Miller,
Yes.
Hagan,
No.
Kemp,
Yes.
Merman,
Yes.
Overman,
Yes.
Smith,
Yes.
White.
No.
Motion carried 5-2 with Commissioners Hagan and White voting no.
Okay, thank you. Ms. Beck, is there anything else?
No, sir, that concludes my presentation.
Okay, we're going to get the EPG discussions, and I'm going to start off with the EPG discussions, and this is something that Commissioner Smith was addressing. And as I said before, when we try to make the amendments to some of our orders, we don't want to try to make the amendments and vote on them at that same day. We want our county attorney's office to go back and work on those amendments and then email them or get them to you so you can review them and then vote on them on the next meeting. So I'm going to ask the county attorney at our August 13th meeting, would her office bring back an amended face covering order for this board's consideration that deletes the requirement in paragraph 15 that the order be reviewed every 7 days, and to now state that the order will remain in effect throughout the state of local emergency pursuant to COVID-19 unless earlier rescinded or amended. So I hope that Ms. Beck, can you bring that back to us next Thursday?
Yes, sir.
Okay. All right. Any other discussions? We have any other discussions today? Anyone else? Commissioner Oldman, you recognize.
Chair, thank you very much. Could Ms. Beck also consider bringing back language? Obviously, it could be two different versions if you don't want to clump them in together. But possibly to address the state Florida Surgeon General or the American Academy of Pediatrics white paper that's just that an age for children in wearing masks to protect those children be either school age or age of 5, which is typically what is recommended by the Surgeon General as well as the American Academy of Pediatrics. That's our school age kids, where we have a lot of kids that are going to be put together in one way, shape, or another if the brick and mortar is opened. I think and it's also increases our potential for community spread. And just to give our members a little bit of background, we previously had just, I think more than anything, arbitrarily picked age 8. And so using our professionals that are our public health professionals and those that are providing guidance to our school systems and our pediatrics, I would rather see that our mask order include the research and our medical professionals' recommendation. So if you could bring us back some language to consider bringing it back where the recommendation for mask covering is in alignment, not only with as best possible with the state Surgeon General, as well as the American Academy of Pediatrics, that would be great for discussion and consideration next week.
Mr. Chair, may I ask a question?
Yes, ma'am.
Commissioner Overman, are you suggesting that the exception go from the age of 8 to the age of 2, just to be clear?
Currently, the Surgeon General recommends usage for children over the age of 2. Whereas the American Pediatrics is above, chapter is above the age of 5. I'm willing to consider either, given that those are medical recommendations. And so, and our current order doesn't seem to substantiate the choice of age 8 as an exclusion. So, obviously I'd love to hear from the body, but if the age is just the issue, then we could always discuss that and choose which age seems appropriate that this county wants to adopt as a policy for the mask mandate.
Yes, that's very helpful. I understand now.
Excellent. Thank you.
Thank you.
Okay. Commissioner Smith, do you recognize?
Thank you. I just want to briefly address a couple of things that other commissioners brought up. I have respect for Commissioner White's points about the way that people react to mandates, but I would just like to offer a couple of other things for consideration, and that is if it's a recommendation rather than a mandate, it makes things very difficult out in the public. When we have a mandate, we take the responsibility, and the businesses in our community then have us helping to run interference for them, and a reason to put a sign on their door and say masks are required based on a Hillsborough County ordinance, based on a government ordinance. And so it is up to us to do and protect the public health. Instead, it makes it much easier on our businesses who want to encourage mask use, protect their employees and their customers, if we take that burden and authority and don't just leave it all up to everyone to decide for themselves. This is a public health issue that is our responsibility ultimately. And so that's why I think the mandate makes sense. As the point about the enforcement being difficult, I've heard that from some people, but any enforcement of any rule, speed limits or wearing helmets or in certain situations or seat belts are all laws. Any laws are difficult to enforce perfectly, but we have those laws and most people will obey them. And whether or not they're enforced perfectly or not. So the difficulty of enforcement is really not even our question. The question before us is what should the rules be? But last, I would just say I agree completely with Commissioner Overman that our rules, our ordinances, whatever they are best grounded in medical recommendations, medical data. And I watched the EPG meeting where the 8 years old was decided kind of based on anecdotal feelings about some people, how their own children react or don't react. And I think we're much better off if we can present the public with ordinances that are based on best medical advice and professional advice and data. So I'm glad that you're bringing this forward. It will provide more credibility and confidence in our ordinances to have them founded in professional medical advice. Thank you.
Commissioner Merman, you recognize.
Thank you, Mr. Chair. And actually, Commissioner Smith just made quite a few points I was going to make, that the actual age we came up with, and Commissioner Overman probably remembers this, was just a discussion. We had a lot of different ages we were discussing, and how we landed on the age 8, I think was more of a consensus between all the people and all the ages people were bringing up. The school district, of course, has mandated mask if the kids go into the bricks and mortar classroom. So nothing we would do in the age would affect that, but I do think it needs to be more reasonable. And I do think, like, my 5-year-old grandson wears one all the time. So 5, 6, preschool. I think, and we need to look at the data. The data is what drives these decisions. It really does have to drive them. And as far as wearing masks, and I do respect Commissioner White. He is a medical professional. And I have always said the science and the information backup that we have had consistently from the CDC through medical schools throughout the United States, Harvard, you name it, all of our medical professionals here have given us all the information that drove our decisions to do indoor masks. I think at some point, we need to figure out what that is where we don't need the mandate any longer. And I think if the numbers continue to drop, for me, it's going to be, that will be a big decision that will be for me. Because I think at some point we have to let it go if the numbers start really getting down to a level that's reasonable. So I think this is a great discussion that we're having, and I'm glad everybody's thinking about, but data's going to drive it all the way to make every decision we make. Thanks.
Commissioner Kemp, you recognize.
Thank you. I'd just like to point out that it was weeks ago that the governors of Texas, Mississippi, and Alabama all mandated masks statewide. I think it's in some 35 states. I don't even know what it is. We're the entire state. And it's unfortunate that the burden's falling just on county government to do this, because I think we'd be safer and better off here in Florida, since we have a raging pandemic statewide in every single county in Florida. We have had deaths in little counties with 8,000 people. We have more than 100 cases that we know of in every single one. So I think we very, very much need a mask mandate. I think 8 is, by anything I've read or been familiar with, way too old, especially when the schools, which I guess they just voted to put off opening for 4 more weeks. But when the schools, when we're looking at what they're doing in classrooms, community spread, 8 is too old. I tend to lean somewhere more, and having read a lot, between 4 and 5 as a possible thing, maybe closer to 4, maybe even to 3. But I thank Commissioner Overman for bringing that up, and I think it's very important for public safety. And I don't know when right now, we're going to be able to lift this, because it seems like a really best practice to stop the spread and be able to get our schools open and be able to get our jobs back and everything else in our communities. This is the best, most important thing we can do.
Thank you. I just got an email here, a text that the school district has decided that they will start on August 24th with e-learning, and will come back on September the 8th to review it again. So if this is correct, they will start schools on the 24th of May, 24th of August, it will be e-learning, and they will again review it on the September the 8th. Commissioner Overland, you recognize.
Thank you. And I'm really happy to hear that to some extent, because I recognize how complicated it is for the school district to help manage the risks associated with community spread. It's a mammoth task. You know, this subsection of this group has been dealing with this since March, and we still don't have it down to science yet, but we're, been able to deal with it very, very quickly. And I'm glad to see that they've made this decision so that they can have a plan in place in the event that they do decide that brick and mortar is able to be done. Dr. Holt did testify earlier today to give us that guideline. And I do think that in the future, when we're talking about the trends, given that we have stabilized at this point, but it's at a too high level, keeping that perspective on how long it takes for policy and events to show up in the numbers, I think is an important perspective that we can take. And Mr. Wagner, Kevin Wagner, has done a phenomenal job of giving us that perspective and showing us those data points. And I would highly recommend that we continue looking at those trends when we make any recommendations for adjustments going forward. So it's a really nice perspective to be able to recognize it takes anywhere from 14 to 30 days to see change. And depending on how well our citizens make changes to adapt to what's going on. I do want to see more and more testing. If the largest employer of Hillsborough County, which with 200 and something kids and our children and 100,000, workers or however many workers there are within the school district are together, we have to be able to deal with the capacity needs of the testing. And our staff has done a marvelous job of that. But I would like to see not only what we can find, is our testing numbers, which we do see from Mr. Dudley, but seeing the total testing numbers within Hillsborough County is also important. We've only tested 85,000 people, according to the report we saw today. And that's, a third or half of the number of people that are suddenly going to come together when our schools open. So I think it's important for us to recognize our capacity and what we might need to do going forward should we have another surge related to school opening. And I think that's an important thing for us to pay attention as they make their decisions to address our children's education. So I'll stop there.
Okay, I see no hands for further discussion. Let me say this before we adjourn. I understand, I know everyone's extremely happy to say they see the numbers coming down in our county. We're still fluctuating, I think 300 to 400, but today, statewide, the numbers went up. But let me give you something that you need to think about, and you can get happy if you want to, but still be ever mindful that we have a deadly and dreadful disease out there. When the governor took this county, took the state back, took us to phase 2 on June the 5th, if I have the date right, we were averaging 49 new cases a day, 49. On June the 16th was when our numbers started to tick up. I've been keeping track since that time. Since June the 16th until today, we've had 27,684 cases, averaging 554 a day. On 49 a day, we're now at 554 a day. I understand that we're happy to see those numbers on a daily basis go down, but we're still averaging 554 compared to 49. Just be mindful of that. Keep that in the back of your minds. If we see I don't see any other hands, and I keep a daily track of that, so you can always ask me. I have it for you. I see no other hands. Everyone have a great weekend. Stay safe. Happy birthday, Commissioner Merman. Hope you have a great day and stay safe. You're now still older than I am. Okay.
Not by much.
Everyone take care. Have a good weekend. We'll see you again next week. Our next meeting is on Thursday, so we adjourn. Take care.
Thank you.
you.